The term choice architecture characterizes a variety of techniques for influencing consumer decisions. Sometimes choice architecture is bad. Let me give you an example. A university I was working with had 3 medical plan options. They called them a gold plan, a silver plan, and a bronze plan. I looked at the deductibles, the co-insurance limits, the out-of-pocket limits, the payroll deductions for the different plan options. It made no economic sense whatsoever for anybody to choose the gold plan. Yet 29% of faculty and staff at this particular university chose that gold plan. It's an example of bad choice architecture. Why do organizations want to influence people to make better choices with their healthcare benefits? Well, we want people to live healthier lifestyles. We want people to be efficient consumers of healthcare services. And we probably want to start to migrate people away from some types of legacy PPO-style plans and to plans like accountable care organizations or to consumer-directed health plans. I had a great deal of fun in 2012 conducting focus groups with human resource directors and finance directors of colleges and universities across America. In each of those focus groups, I asked the same question, the same 3 questions. Which of these medical plans would you choose for yourself at open enrollment? How many servings of fruits and vegetables does the average American adult eat per day? And to what extent are you optimistic that Americans will reduce their tobacco consumption in the next 3 years? And what's interesting is in each of those focus groups, the left side of the room was more inclined to choose the legacy PPO style plan than the right side of the room. The left side of the room felt that Americans ate fewer servings of fruits and vegetables per day than the right side of the room. And the left side of the room was less optimistic about tobacco cessation in America over the next 3 years than the right side of the room. Is there something odd about sitting in the left side of the room versus the right side of the room? No. What I did was I gave a package of information to each person. The left side of the room got one choice architecture in terms of how the communications were prepared, and the right side of the room got a different package of communication materials. Similar in a lot of ways, different in some key ways, and that influences choice making and decision making in a significant way. Let's take a look at the differing choice architecture that the left side of the room received versus what the right side of the room received on this first question about what medical plan choice would you like to make for the next year. The left side of the room received a real traditional communication approach where we highlight the plans and we describe feature after feature after feature in the plan design. Contrast that with what the right side of the room received. We've reordered the plans to emphasize the healthy living plan and the thrifty consumer plans first and positioned the legacy PPO plan last. We've also identified key decision-making factors that are important when making a choice about medical plans. You can see the columns in this chart show the annual payroll deduction differences, the company contribution to the health savings account, the annual deductibles, and the plan benefit percentages. Framing the options in this manner nudges people toward choosing either the healthy living plan or the thrifty consumer plan. And these are the types of plans that plan sponsors want employees increasingly to choose in the years to come.